everyone, 大家好. My name is Kevin and I'm a consultant radiologist at the Hong Kong Children's Hospital. I've recently completed my Pediatric Interventional Radiology Fellowship at the Hospital for Sick Children in Toronto, more commonly known as Sick Kids. My fellowship was delayed because of COVID, and during those few years before it began, I was already practicing some pediatric IR and came across some pretty challenging cases where I had to use access routes other than the femoral artery. For example, I've once used the axillary artery to perform an angioplasty in a renal artery stenosis case in a child where there's renal artery has an acute takeoff, and at another time I used the umbilical vein in the neonate to cross into the arterial system through the patient ductus arteriosus to embolize a very high-flow hepatic hemangioma. A few months before my fellowship officially started, right around the time of the RSNA abstract submission deadline, I thought, why not share these experiences? So I reached out to the staff radiologists at Sick Kids and some of my mentors from the Society for Pediatric Interventional Radiology to collaborate on an exhibit about unconventional arterial access routes in children. It was really a whirlwind. We pulled everything together in just about a week, and it was an incredibly rewarding experience. We were very lucky to have our abstract selected for both electronic and hard print display at the RSNA. When I was preparing for my poster, one of the hardest things was to try to not just make a collection of pretty looking cases, but really to think about and synthesize a practical guide approach for pediatric arterial access, especially for those who usually work with adults but may occasionally be called to treat children, such as in trauma or emergency embolization situation. Therefore, in addition to focusing on alternative arterial access routes, such as the umbilical access, which is unique in children, we also put emphasis on how to optimize peri-procedural settings to ensure success and prevent complications when performing conventional femoral access. Having served on the radiographic training editorial board and having had the privilege to sit on review panels for selection of education exhibit for publication in RadioGraphics, I knew really how high the quality of the submitted exhibits are and how competitive the process is. So I was really happy when I got the email saying that our exhibit was solicited for potential publication as a full manuscript in RadioGraphics. The timeline to write up the manuscript was quite tight, so it was good to have some good planning ahead. I found it very helpful to discuss with seniors who've had previous experiences in publishing in RadioGraphics to get some insights from them to how to structure the manuscript in a way that is comprehensive but not overly loaded with information. One good way was to use tables to summarize key learning points. They not only make the paper easy to digest, but also serve as a quick reference guide for readers. To be honest, RadioGraphic has always been my go-to journal for educational content since my training days. I never imagined that one day I'd be an author here. This whole journey from exhibit submission to manuscript revision has taught me so much on how to craft a meaningful educational material and how collaboration can turn an idea into something that can help others learn. If you're thinking about submitting an exhibit this year, my advice is start early, choose a topic that you're passionate about, talk to your mentors, and collect good illustrative cases. You never know, your idea may end up inspiring others, just like this one did for us.